Hey guys, it's Michael at the Spine Center. Dr. Smith is back from surgery this morning and we have a great question for him. So, Dr. Smith.
Yes.
Hey,
Is it that time again?
It is that time. How was surgery this morning?
It was excellent, living the dream, making the world a better place, another life saved, that kind of stuff.
We had a question.
And I also voted today. So you might tell everybody, I don't know when you're going to put this video out, but remember to go vote. I did the early voting.
That's what I did.
Meaning I went early in the morning. No.
I went early last week. Vote early, vote often, right?
Okay, what's our question of the day?
We had a good question. Some people have been watching our surgery videos, and they've noticed that there's people in the operating room that aren't wearing gloves. They're wearing masks, but not gloves. So there was a question about, is that safe? And what are those people doing?
Quick, let's go get them. Actually, first of all, thanks for watching the videos. And when you look at a operative suite, it's actually divided into two sections. You have the sterile section and the non-sterile section. And certain people are classified as being sterile and certain are classified as unsterile. So for example, there will be some that circulate around the room, known as the circulating nurse, that will come in and out of the room bringing stuff in. So the sterile surfaces, and actually they're not sterile, they are what we call aseptic. So you have certain environments in the room that are considered aseptic. And aseptic just means it's not free of bacteria, but it's supposedly steps have been taken to keep it free of harmful bacteria. So that's what aseptic means. In a typical OR room like ours, anything that's covered in a blue sheet, blue means sterile. So if you see a table with a blue sheet on it, all the tools and surgical equipment on top of that table would be considered sterile. It's considered sterile to the edge of the table. So you may see somebody touching it in other places, moving the table. As long as they don't touch the top of the table, then it is considered sterile.
I know I never told you this. One time when I was recording a surgery, I got kicked because I got too close to the table.
Oh, did you? Well,
it was a very nice kick, but it was still a kick.
Well, yeah, there's always somebody in the room whose job it is to watch and make sure nobody violates the surgical field, which brings up another point. Every now and then, even I, as a surgeon, may do something to contaminate myself. So, for example, if I have a tool in my hand and I reach back to the surgical table and I touch the edge of the table, that glove, that hand, and that tool would be considered non-sterile. And so then I would have to drop the tool, change my glove, and they would give me another glove. But sometimes you do it without even noticing it, and then somebody may mention something. And so, for example, one of the nurses, or really anybody, may say, "Dr. Smith, I think you touched something, your left hand's not sterile." And the rule of thumb is you never question. And you'll see kind of newbies in the OR that come in and they'll say, "No, I didn't touch anything." And they'll argue about it. And it always seems so odd because somebody is basically, I've spent my whole life in the OR, that's all I've ever done. To hear somebody not know the normal technique that goes on in the OR is just kind of odd. But so if the nurse or somebody says that you contaminated a glove, you just change the glove. It's not worth taking a chance. There's no debate, there's no discussion, you just do it. As far as the surgeon himself, he is considered sterile from the axilla, which is the armpits, down to the level of the surgical table, whatever that may be. So the sterile portion of the surgeon is only about like this. It's not the whole surgeon, even though he may be completely dressed in like a blue gown. As far as his arms, the arms are considered sterile up to 5 centimeters above the elbow, which is about 2.5 inches. So that's really all that's sterile. The back of the surgeon is not sterile, so you may see in the video somebody touching the back of the surgeon. That's okay. The surgeon, if he backs up against a table behind him, then he would contaminate that table. So just the top of the table, that portion of the surgeon, and what else? Those people that are going to be in the surgical field have to prepare themselves to go into the surgical field. That would be the actual surgical team. Everyone knows that in the hallway you wash your hands. There's a certain protocol for washing the hands, certain type of soap that the FDA says you may use, but they're changing that all the time. And there's actually never been any good studies on those soaps. Well, not in many, many years. And most of that is because you can't really do a controlled study on the soap. You'd have to have half the patients have surgery with a surgeon that didn't wash his hands, so I don't see that study taking place. So there'll probably never be a good controlled study on the type of soap that a surgeon should do to wash his hands. Though there are certain guidelines that have been given, and that's what we tend to follow, though they do change periodically. And the types of soaps chosen tend to be soaps that rapidly decrease the population of organisms and also leave a coating on the hand so that even up to 6 hours, well, it's supposed to last at least 6 hours, give you some antibiotic killing ability from just the soap residue left on your hands. And that's because even though we wear gloves, you may get a hole in the gloves, and if you get a hole in the gloves, you don't want to contaminate the patient. So even the skin itself is coated in a type of soap that leaves a residue. I read a study the other day that they said that up to 35% of surgeons get holes in their gloves during a routine case, so that's quite a bit. If you double glove, which we always do, you decrease that to about a 4% chance of getting an infection. Though they estimate that not wearing gloves at all actually doubles the patient's chance of catching a surgical site infection, but which it's relatively low anyway, so it goes from 1% to 2%. So maybe we don't even need to buy gloves.
I think the gloves are on this. It's a safe bet for the gloves.
Okay, let's stay with, we're going to stick with the gloves, and I'm going to continue to wash my hands. Okay. So that's basically the main thing is you will see people in the OR that don't have gloves on. Everybody has to have a mask on, but they won't have gloves on because they are not actively involved in the surgery as far as participating on the surgical field. So as long as you don't touch the surgical field, you don't have to have the surgical gown, and you don't have to have the surgical gloves. You will notice you have the patient that is a surgical field, and you have a table with tools on it. Both of those are considered part of the surgical field. Anybody that is not part of the surgical team is never supposed to walk in between two surgical fields. So you notice that's why they say circulate around the side of the room. So if you have a Mayo, for example, with some tools on it, and another Mayo and a patient, all that area, no one's supposed to walk between those. They have to walk around the outside. Theoretically, they could touch those from the back as long as they don't actually touch the top of it. So that's the main thing.
But that's also likely to get you kicked.
Oh yeah,
I know
it
this
will
from
definitely, yes,
so.
it'll get you kicked. If you get too close to the field, they're going to let you know. So that's, I guess, basically the main stuff. Some ORs actually have what they call laminar airflow, and that's where one entire wall is made up of a fan, and it's usually at the foot of the table, and it blows the air across the patient in a single direction, and then nobody that's not in the surgical team can get between the patient. Well, nobody's really supposed to get between the patient and the actual wall, but everybody else has to stay downwind. Anesthesiologist would be downwind, and everybody else is downwind. And that's just to, because it's an aseptic environment, it's not a sterile environment, and we're trying to keep down the amount of harmful bacteria. Some of the ORs in the city also use ultraviolet lights along the ceiling, though they don't use that as much as they used to, and I don't think they use laminar flow as much as they used to. In certain cases, the surgeon will put on what they consider we call it a space suit, which is basically, it looks like a biohazard suit. If somebody is having a procedure that's having a large implant, such as a total joint or something like that, then they may wear those devices, and that just minimizes shedding from the surgeon to the patient. So you'll hear about that as well, but that's the main stuff about surgical fields. Can you think of anything I left out?
No, I was going to ask you about if there was ever even more advanced protection, but you just kind of talked about it, so I'm
Yeah.
good. I think I'm good.
You don't see the laminar flow as common as you used to, but some places in the city still use it, and some of the places still have the ultraviolet lights on the ceiling. Another thing you'll see in the movie sometimes is, like, if the surgeon's late, in order to keep everything sterile, they'll cover everything with like sheets and stuff like that. That doesn't really happen. And the reason for that is because if you put a sheet over a surgical field, it would be impossible to take that sheet off without contaminating the field. Because remember, everything over the edge is now contaminated, so you couldn't do that. But that does bring up a good point. Many times they will set up the surgical field, and then for some reason the surgeon is running late. It can only stay out there for a limited period of time before beginning the surgical procedure. And I can't remember exactly what that time is, but I'll say 45 minutes. If they haven't started the surgery within 45 minutes, they have to tear down the whole field and then set it up again. And that's it. Another thing with, people always ask about antibiotics. In this day and age, and then every now and then I'll get somebody that goes home and they'll call me because they've checked the medicines and the handouts they've been given, and they don't have any antibiotics to take at home. But one of the big problems is the fact that people get too many antibiotics. So with the routine surgical procedure, you're not going to be sent home on antibiotics. And we actually follow the national guidelines as far as antibiotics are concerned. They're given before the surgical procedure, say 30 minutes before the surgeon actually cuts skin. If it goes past a certain length, they'll get another dose, and it depends upon the weight of the patient. So chances are, any place in the U.S. today, if you come in and you have surgery and you leave, the antibiotics that they're required to give you are in your system.
Cool.
And I guess that's it, but don't get an infection, okay? And thank you for writing the questions. Please, that was kind of a good answer, so give us a thumbs up and subscribe, and we'll see you soon in YouTube land.
See you soon.
Thanks, bye.
Cool.